Hey, welcome to the Asthma Inhalers video for primary care nurse practitioners and nurse practitioner students. I'm GB. In this video, first we will assess the knowledge of asthma inhalers by simple basic questions, but very important to know. Next, you will listen to my previous channel video of asthma inhalers. I deleted the email in the channel, so I'm adding those videos to my current channel. As we all know, there are a lot of inhalers in the market, especially in the last 5 years. So for new nurse practitioners or nurse practitioner students or generally in providers, I hope this asthma inhalers video will help you in ordering or prescribing the right dose of inhalers and knowledge about the component of inhalers and their side effects, and also educate the patients how to use the inhalers and the right technique so you can improve the practice. And there are the questions are like this. Number one, examples of SABA: Advair, Stiolto, Brio, Ventolin. I give the trade name so at least it's easy to answer it. Number two, which class of medication has side effect of oral thrush? ICS, SABA, LAMA, and LABA. Symbicort inhaler belongs to which group of medications? ICS plus LAMA, ICS plus LABA, or LAMA plus LABA? If you don't know the expansion of all these, my inhaler video will help you to understand everything.
Hey, I'm GB, nurse practitioner working in primary care in Right Focus Healthcare LLC. Regarding my clinical experience, I have worked as pulmonary nurse practitioner and primary care nurse practitioner for 3 years. This video is about asthma medication, especially inhalers in detail, made as an educational review for primary care nurse practitioners. Asthma is classified into intermittent asthma, mild persistent asthma, moderate persistent asthma, and severe persistent asthma. Medications for asthma are categorized into two general classes. One is long term control medications, which are used to achieve and maintain control of persistent asthma. Examples: LABA, ICS, leukotriene receptors antagonist. And then number two, quick relief medications, which are used to treat acute symptoms of short of breath, cough, and wheezing and prevent asthma exacerbations. Examples are SABA, anticholinergic medications, and systemic corticosteroids. I have discussed asthma treatment in another video in detail, but just to discuss inhalers, I'm just doing a quick review of the treatment of asthma. As you can see on the third row, for intermittent asthma, SABA as needed. For persistent asthma, the step 1 low dose ICS or cromolyn or leukotriene receptor antagonist or theophylline, and step 2 low dose ICS plus LABA or medium dose ICS, alternative low dose ICS plus either leukotriene receptor antagonist or theophylline, and step 3 medium dose ICS plus LABA or medium dose ICS either leukotriene receptor antagonist or theophylline, and step 4 high dose ICS plus LABA and consider Xolair for patients who have allergies, and step 5 high dose ICS plus LABA plus oral corticosteroids and consider Xolair for patients who have allergies. For regarding SABA, per GINA guidelines 2023, SABA alone is not recommended as a treatment modality. Let us discuss the quick relief or short relief or rescue medications. The number two, SABA, short-acting beta-2 agonists, are the common ones. The examples are in the pictures: Proair, Ventolin, Proventil. They can be used as 1 to 2 puff Q 4-hour PR and short of breath. Their action is by they act on beta-2 adrenergic receptors and causes bronchodilation. They can be used for the relief of acute symptoms of short of breath, cough, and wheezing, and prevention of the exacerbations. They can be recommended prior to exercise, prior to climbing stairs, or patients are doing strenuous activities. Some of them may get a tachycardia or something, but rarely happens. Those are the patients we would say anticholinergic one. For example, Atrovent. The other one, Spiriva and Incruse, is usually a control medication. We add it to the regimen, the asthma regimen, if the other medications are not enough. So how the anticholinergic works, they act on they inhibit some muscarinic receptors. The acetylcholines binds with the protein in the airway muscles and then produces and make them contract, so and also make the exocrine glands to produce mucus. So by the anticholinergic action, the airway muscles are relaxed and also reduces the mucus congestion. So the examples are, as you said, Atrovent is the one which is used for quick relief. Next is about systemic corticosteroids. Systemic corticosteroids are used in moderate to severe asthma exacerbations, and their action is by control and reversal of inflammations. Examples are prednisone, prednisolone, and we used it as a burst treatment for 5 to 10 days. Maximum is 50 milligram per day. In clinical settings, we use like a tapering 40-20, which is recommended. And when we talk about asthma exacerbation, what is asthma exacerbation? It's worsening of respiratory symptoms like cough, short of breath, and wheezing. Patients are unable to talk. And but if it is the oxygen saturation is above 90 to 90%, we can treat them in the outpatient settings with antibiotic and steroids. But if the saturation drop down less than 82, 88 or 90%, we may have to send to them to the hospital. And also meanwhile, while we are treating with antibiotic and steroids, we have to treat the patients any comorbid conditions like allergic rhinitis, sinusitis, obesity, or any kind of stress. So most of the time, systemic corticosteroids produces an immediate speedy recovery and prevent further deterioration of the condition. The long-term control medications are corticosteroids, LABA, leukotriene receptor antagonist, and immunomodulators and methylxanthines. Let us discuss one by one. Let us discuss corticosteroids. The inhaled corticosteroids, examples are budesonide, fluticasone propionate, and mometasone furoate. And fluticasone propionate is Flovent, which can be used 2 puff twice daily. The pictures are on the right side. And mometasone is Asmanex, which is 2 puff twice daily. Where is it used? It's used for long-term prevention of asthma symptoms and reduce infections. And we have discussed the treatment that is in the first step, and reduce need of oral corticosteroids so that the patient does not go to step 5. And there is a side effect. It can cause side effect of oral thrush, so that's why we have to make sure patients know they have to rinse their mouth after use. Systemic corticosteroids we have already discussed. Let us discuss a long-acting beta-2 agonist, which is LABA, which are used for long-term prevention of symptoms of asthma, and it's always added to ICS. It never used like alone much, and not used for any treatment of acute symptoms. The action is by smooth muscle relaxation and bronchodilation, and the onset of action is 15 to 30 minutes but lasts for 12 hours. So the examples are formoterol, salmeterol. Very important for nurse practitioner to educate the patients, because of the formoterol, the ending in the trol and trol, patients can confuse it with the albuterol, which is the short relief medication. So when they are short of breath, some of the patients can try to use these LABA, and they won't going to go get relief from it. So that is very important for them to understand the difference between SABA and LABA, which is LABA is only for the control. It wouldn't produce any acute relief of symptoms. As we discussed in the review of the treatment, you see that in the step 3, 4, and 5, they recommend the use of ICS plus LABA. inhaled corticosteroids plus long-acting beta-2 agonist, which is the primary use is for long-term prevention of asthma symptoms. And as you can see in the table, there is low dose, medium dose, and high dose of steroids. So when you assess the table, you can see Advair 45, 115, and 230 in each one. So the steroid dose is going high. And also, you can observe that the HFA is mainly 2 puff twice daily, and the disc is only 1 puff twice daily. So that what that means that whoever whatever technique they are using or whatever inhaler they are using, they have to use the correct technique, because even if make 1 puff, it doesn't give them relief, and they are going to repeat it, which is not going to be which is not recommended, or which is not good for the patients. So what we should make the patient self-teaching, self-monitor is that if SABA is greater than 2 times, if their SABA use is greater than 2 times a week, means the controller medications they are on, like a first low dose, is not enough. They have to switch to medium dose, and that's why they need to see a doctor so that they can step up the treatment. The examples, the Advair is a combination of fluticasone and salmeterol, which is 2 puff twice daily. And I have seen that the Vixela is kind of cheaper per patient's reports. Vixela is 1 puff twice daily. I have to add one more point. LABAs are never used as a monotherapy for long-term control of asthma. Next is leukotriene receptor antagonist, is also long-term control medications. They function as leukotriene related enzyme inhibitor. Leukotrienes are produced by immune system and cause bronchoconstriction, inflammation, and mucus secretion. So by leukotriene receptor antagonists, they are working against mucus secretion and inflammation and produce vasodilation. So the examples are mondelukast, or other name is singular 10 milligram tablet, POHs. That is a very good alternative therapy if the patient does not like inhalers, or is as reviewed in the treatment, it's adjunctive therapy or alternative therapy with the ICS. Then immunomodulators, omalizumab or anti-IgE or Xolair is used for the patients who have severe allergies. The dosage is 75 milligram 0.5 ml, 150 milligram per ml for sub-Q use. The action is that it's a monoclonal antibody that prevents binding of the IgE to basophils and mast cells. So what happens is that it reduces the mast cell release from allergen, and it reduces the submucosal cells and thereby mucus production. And very important, there should be an anaphylaxis reaction, so the office setting should be prepared to do that. A word about Coumadin sodium, which is stabilize mast cells and interfere with the chloride channel function, uses an alternative, but it's not preferred, or I have never seen anybody using it. Then next is theophylline, which is a methyl xanthines. They are used for long-term. It's used for long-term and control and prevention of symptoms. It's used as an adjunctive therapy with the ICS, as we see in the reviewed in the treatment step 2, 3, and 4. It produces bronchodilation, smooth muscle relaxation, and decreased T lymphocytes numbers. It comes in extended release tablets like 200, 100, 300, 400, 600 milligram. But if the renal clearance is low, not exceed more than maximum is 400 milligram per day. And the most important thing of theophylline is that we have to monitor the therapeutic level, has to be maintained between 10 to 20 milligram per liter. And also we have to check level once we initiate 3 days after we start the dose. Usually is that it's 300 to 400 milligram daily into 3 days when we start it, and then 400 to 600 milligram daily, not exceed more than 600 milligram daily. Next is the least choice is that LAMA. When there is no other options are preferred for the patient, we can use like Spiriva, the lowest dose 1.25. We have used it as a Spiriva Respimat as an additive therapy to the asthma. Other than we already discussed about how they are as quick relief medications at Truvent. As we discussed in the treatment, the disc is usually lesser dose than HFA, which is like 1 puff twice daily or 1 puff once daily compared to 2 puff for the HFA. So we have to make sure the patient get the dose and by the right technique. So I will just summarize in short. Open your disc and slide the lever until you hear the click, and then you see the mouthpiece. And then before you insert the mouthpiece, breathe out as deep as you can, and then put the mouthpiece in your mouth and just do a deep breath. Hold the breath for 10 seconds. Do not breathe into the disc, and then close it and breathe out. So make sure you rinse your mouth after the use. Next is HFA inhaler. How we educate the patient about it. Most of the time it would be 2 puff twice daily. Hold the inhaler with the mouthpiece down and shake it well before use. Breathe out through the mouth and do it as much as you can, and then put the mouthpiece in your mouth and close your lips around it and push the top of the metal canister all the way down while you breathe in deeply and slowly. Then after you have breathed in all the way, take the inhaler out of your mouth and then hold your breath for about 10 seconds for as long as you're comfortable. And then if the dosage is like if it is 2 puff, wait for 1 minute and then shake the inhaler and then repeat the same step again. Put the cap back on the mouthpiece and snap secure after you finish using the inhaler.
Hey, I hope you listened to the asthma inhalers video and you got more information and knowledge about asthma inhalers, and you know the answers of the quiz. Example of SABA, the answer is D, Ventolin. Which class of medication has side effect of oral thrush? The answer is A, ICS or inhaled corticosteroids. Number 3, Symbicort inhaler belongs to which group of medications? The answer is B, ICS plus LABA. I hope this video will help to improve your practice, and thank you again.